Hello, I'm Damon McCool, Public Programming Specialist at Eastern State Penitentiary, standing in for Marnie Penn. Welcome back to Prisons in the Pandemic, where we examine the ways COVID-19 is affecting the lives of incarcerated people, correction staff, administrators, and other stakeholders within the criminal justice system. There are now 37,205 confirmed cases of incarcerated people with COVID-19. That's a 15% increase since late last week. In total, 465 incarcerated people have died from COVID-19, which is a 9% increase since last week. Cases among prison workers are up 6% during that same time, now totaling 10,028. There have been no additional deaths of people that work in prison since our last report. Let's take a look at one of the news stories making headlines this week. Recently, the United States went 65 days without carrying out an execution, the longest streak since 1973. Missouri executed Walter Barton by lethal injection on May 19th, the nation's first execution of a death sentence individual since the coronavirus pandemic took hold. The last execution took place on March 5th in Alabama. 15 states, including Ohio and Texas, have stayed, rescheduled, or granted reprieves for execution during the COVID-19 pandemic. Pundits say that the pandemic-induced slowdown of executions could provide an opportunity for opponents of the death penalty to make strides toward ending the practice. The number of death sentences has dramatically decreased in recent years as wrongful convictions and botched executions have garnered more attention, but a majority of Americans still support the death penalty. So how do you think COVID-19 will impact the future of capital punishment in the United States? We look forward to your questions and comments. I'm Damon McCool, standing in for Marnie Penn. Thank you again for joining us for Prisons in the Pandemic.